My name is Dr Sifumba. I am trained as a medical doctor, but I am currently in clinical research. Why I wanted to be a doctor. So, my father is a doctor. I love the idea of helping a person. Starting off at medical school was very exciting. Every year, the second years are taken to a TB hospital, and they don't really provide N95 respirators for us. I don't remember them being provided when I was in second year. I was working in the wards, and a couple of weeks later, I developed a lump on my neck. Went to the hospital. The doctor put a needle in the lump. I was called, and over the phone, I was basically diagnosed with multi-drug-resistant TB and told to visit my nearest clinic. I had to get daily injections for 6 months, but I ended up getting a port because the injections were just so painful. I wasn't given any psychological support at the clinic. I kind of just had to make my own way. I stopped taking my medication for my depression and my anxiety because I already had a very high pill burden. I was taking 21 pills. I was sure that I wasn't going to make it. I even had a plan of what I was going to do to take my life. And so when I did finish treatment, it was very strange. Still be alive. Sadly, I knew I had to go back to med school because all I had was my matric. But I was afraid of the system that just clearly doesn't really care if I fall ill and is not going to do things to protect me, is not going to help financially or any other kind of way to actually see me get better. I graduated and it was an amazing day. Didn't think I was going to finish because of the TB, but I finished and now it's time to be an intern. I really struggled with a lot of anxiety during my junior doctor years. People just arrive at work not okay, and then they end up taking it out on other people. Time to see a therapist. Where? Because you're at work from 7:30 until 5. I got into a car accident after a 36-hour shift at work. I fell asleep at the wheel, probably, after that 36, because I had 30 minutes of sleep in that 36 hours. I did go for some trauma counseling, and it really did help. And it made me realize, it made me question why we don't get trauma counseling, just in general. Essentially sending people who you haven't taught the soft skills that are required to deal with that. And then we experience those things, and then it's also hard for us to say that we need help for fear of many things. They could say that you're a danger to the patients. They could say you can't practice anymore. So you just keep it in. My dream is, to help the health system become more people-friendly towards the health students and workers. But I realized that I couldn't do that while inside because I'm going to be treated badly for it, which is sad. So there's just not enough care for us. We also struggle, for some reason, to care for ourselves. Everybody knows that the health system is crumbling and it's bad, but we literally feel it from inside the health system. So we're panicked too. I eventually left the front lines. I realized that nobody really cared about the health worker. I needed counseling. I needed to eat properly, a proper nutritious diet, to have time to myself. Beyond it being just our mental health that's not cared for, for me, it's our general health. We've kind of taken on this role as the giver of health, and we forget to identify ourselves as worthy of receiving help too. And I'm not just talking on behalf of just the doctors. Anyone that works in a health facility, you just lose that care that you felt in the beginning. You're going to deal with human suffering. So why are we not talking about human suffering?